we've talked how obesity has exacerbated COVID in communities of color. What lessons can we learn, not only about addressing obesity, but also to prepare for the next pandemic?
Yeah, I think first of all, we just have to recognize obesity for the disease that it is. It's taken us a long time to get here. It was only 2013 when the American Medical Association actually voted to acknowledge obesity as a chronic disease. And we've had a trickle effect in terms of making sure that we have the resources to care for this patient population that has this disease of obesity. Like we said, we have a disproportionate impact on communities of color. I think we need to think about the different reasons why that is. Structural racism, systemic racism is a huge point. We know that stress leads to deposition of adipose or fat tissue that is increased in communities of color. The Black Women's Health Study proved that back in 2014 when they looked at the impact of everyday racism and lifetime history of racism and obesity in Black women in the largest study done in that cohort, which is the cohort obviously that represents my demographic. But we have to think about all of the factors that play a role, and we have to think about access to care.